So I have been with St. John since February of last year. So the 14th will be my first year with St. John.
Congratulations.
But I have been a law enforcement officer for going on 8.5 years now. Typical day, typically I start off shift. I'll try to come into the station, check my emails, see if I have any outstanding CIT follow-ups, which is the Crisis Intervention Team follow-ups. I'll check through the reports, see if anybody had any type of mental health calls, anybody who might need some type of follow-up or any of that nature. Then after that, I'll try to follow up with whoever I can. Usually I'll do phone calls first, especially if I haven't dealt with them before. Just kind of introduce myself, let them know the type of work that I do, what type of work that we are doing here, what resources they may or may not be able to, or may or may not need. If I can't get in touch with them or I have spoken with them before, I'll try to do a home visit. I prefer to meet people person to person, in person, and go from there and just basically try to see what they need and how I can help them. After that's done, I'll do my typical patrol duties, drive around town, checking for, traffic enforcement, answering calls of service. It's typically how my day goes. A few days ago, we responded to a call, an EMS call. A person was intoxicated, and at the time they were combative. By the time I got there, they weren't combative at all, but they were extremely highly intoxicated. Spoke with his parents, the individual's parents. They advised that, he does suffer from substance use disorders. He's been in and out of detox and therapies, and so we thought the best course of action would be to transport him to St. Margaret's so he could be seen by a medical professional and possibly detox there. Unfortunately, he was released. They advised that he was clinically sober, but sometime between when he was released and 4 hours after, I believe that's the time window, he had actually got into an accident. A train hit him. So he was on the train tracks, to my knowledge, and he's deceased. So when I found out that happened, I wanted to follow up with the family and, see if they needed any help and see what was going on with them. It was rough. It was rough. I developed a relationship with him pretty quickly, and just within the span of 2 days, somebody I thought I'd be able to help is no longer with us. It's rough. I see a therapist myself. The therapist really helped me work on grounding myself in these type of situations and to separate it. But to say that I completely separate it every day, it'd be a lie. It's hard not to bring it home. And it's hard not to, have these feelings, develop these relationships, and to just completely keep it separate. But I think that's what also makes me good at what I do, is because I am still able to have those emotions for these people and still have those feelings and want to help them, despite not wanting to take it home, I guess you could say. I wouldn't say so much as a man, but as an officer, there is still definitely a stigma there. I mean, people are stigmatized in general with the mental health and the substance use issues, but especially in our profession, getting help for those type of issues is kind of frowned upon. It's just the police culture. We are supposed to be, the ones that people go to help. We're not supposed to be the ones that need help, and that's still kind of an issue, which is also why I'm very open about, my experiences. I'm trying to do what I can to destigmatize, because we all go through it, whether we admit it or not. It's a tough job. We deal with traumas all the time, and to say that it doesn't affect us and that we don't need sometimes just somebody to talk, it's part of the job, and that's what we need. We need to do better ourselves. Police suicides continue to go up for this reason. At least that's my belief.